why this is important. I list here my email address on my first slide because I would like to have feedback from anyone about the concepts that I present. I'm pleased to thank the collaborators I've had in our research, both at the University of Louisville and elsewhere in Japan and Cambridge, as shown here. I'm grateful particularly to our nurses, Pam Rakelt and Kathy Bays, who have helped me very much with the concepts I will be discussing. I'm grateful for the support I have received from these institutions, foundations, and corporations, which has supported our research. Also, I'm grateful to Cambridge University Press, which has agreed to publish this book, which should be available in September or October this year, which will have a complete or more comprehensive presentation of the concepts we're going to hear in a moment. I want to reframe our understanding of what aging is. I've been working on aging of the brain since my fellowship in 1977-78, and I think there are wrong attitudes about aging which are very common. And if we have a better understanding of what aging is, we perhaps will understand better what to do about it. So this is presented very succinctly in these two cases I've had. One was a 94-year-old man who said he had Alzheimer's disease because he couldn't remember who wrote the red and the black. And of course, we all know that forgetting Stendhal, a French novelist, is really not important. And I needed to tell him that only 8% of 94-year-old people, only 88% of people born 94 years ago were still alive. So the fact that his memory was not perfect needed to be balanced by the enormous gratitude he should have for his continued survival. Another one was a 65-year-old man who rode a motorcycle without a helmet. I said, "Why do you ride without a helmet?" And he said, "When you're going to go, you're going to go." And this is actually an enormous problem, an enormous cause of mortality and morbidity around the world. People think there's some kind of fate which is going to determine how long they live, and that there's nothing they can do about it. And I think we will all agree that this is wrong. But this misconception from case 2 is not only in uneducated or motorcycle riding type persons, but even in educated people. They often feel that aging is facing them, they're going to decline, and that's it. I will present what happens with aging, why it's important, and the theory of the multiple reserves, which helps to explain what are the most important factors influencing the quality of our aging and what we can do about it. This will be presented as both foundations and applications. That is, the foundations of the concepts of aging and what are the many things that we can do to improve the quality of our aging. First of all, we must appreciate the idea that we don't want to age normally, because most people with age have various disease conditions and disabilities, as shown here. So our goal is not to age normally. Our goal is to make very good choices about our behaviors so we can achieve exceptional aging. And there's a lot known about the processes of aging to suggest what it is that you could do about this. So it is necessary to understand that all physiological functions decline with aging. Some decline more than others, but at least this slide from geriatric medicine shows the blood flow in the kidney, the nerve conduction velocity, maximal breathing capacity, and some cardiac index measure. They all decline. This declines in different ways in different people. However, this is not a disease. This does not always lead to changes in function. Particularly important is the only thing which increases with aging is variability. So if you see here maximal walking speed from 20 to 100, it shows there's a decline. However, if you can see my cursor, the data is near the mean here, but not so much in the older groups. So there are a lot of older people who have completely normal walking speed all the way up until their 90s or 85. What's really increasing with age is the variability. And this variability is true for every measure of function. So there is a decline overall, but not for every person. And in consideration of these 4 reserves you're going to hear about in a second, it's possible to maintain higher levels of function in many cases. A key concept here is the idea that we have a finely balanced process of metabolism and physiology. This was described initially by Claude Bernard, who was a friend of Louis Pasteur, who described the milieu interior, the stability of the internal environment, and that the brain compensated for external conditions so that its equilibrium resulted from a continuous and delicate compensation as the most sensitive of balances. So this balance becomes increasingly sensitive with age. So in younger people, the balance is more robust, which means we need to pay more attention to the various factors that influence the quality of our aging, the quality of our balances as we get older than when we were younger. Of course, this leads to the word homeostasis, referring to all the processes responsible for maintaining and adjusting the activities of the body, a word coined first by Walter Cannon in 1932. But in order to have healthy aging, we have to maintain this stability despite the challenges we face from stresses and from declines of function with aging. Furthermore, we should consider the active process of maintenance and establishment of health, which is a relatively new word, salutogenesis. Instead of pathogenesis, salutogenesis is the origin and maintenance of health, which illustrates the concept that health is not a passive process. Health is not the same thing as absence of disease. And we can make a difference in this by taking control of factors that determine our health and fitness. And the key matter here is interdependence. Our brain is interacting with all the other organs, and the function of the other organs are maintaining and allowing the normal function of the brain to proceed. So it's this interdependence of the brain and the rest of the body, as well as ourselves with other people, which is the key to health and fitness. So a key issue in my developing these ideas was finding this quote from James Lowell, who was an important American poet. I was wondering, why do people consider aging to be inevitable? And he said, there's no good in arguing with the inevitable. The only argument available with an east wind is to put on your overcoat. The idea here is, if it's inevitable, we can't argue with it. We just have to accept it. So if you consider aging to be inevitable, this leads to a rather negative view that, well, what are you going to do? When you're going to go, you're going to go. Right? It's our fate to decline and to have loss of function. I think rather than not arguing with it, we need to argue. We need to argue with aging, and we need to put on our overcoat like poet Lowell is doing in his photograph. But we need to recognize that aging is not inevitable. I've asked a lot of people about this, And this paper in Lancet said aging is inevitable, and many, many other citations say the same thing. I just point out that of all persons born 65 years ago, only 86% are still living. So I think because many people don't live long enough to be old, aging is not inevitable. And also, it doesn't happen to everyone. So we know this, of course, about Princess Diana, and everybody listening, I'm sure, knows people who didn't live long enough to be old. In my neurology residency group at Mount Sinai in the 1970s, 4 of our residents died of AIDS before they got to be 35. I'm sure if they were here and could hear us saying that aging is inevitable, it happens to everyone, they would be rather upset because they didn't get a chance to be 40. So I view this is rather a critical matter. It's not inevitable. Aging is not inevitable because it doesn't happen to everyone. So we're all one day older than we were yesterday, but we're not one day older tomorrow than we are today, because survival from day to day is not guaranteed. Secondly, aging is often seen as the same thing as decline, and this is wrong. It's possible to build muscle mass with aging. It's possible for a 60-year-old with heart disease, obesity, hypertension, hyperlipidemia to improve their cardiac function through diet and statins and exercise in the 10 years before they're 70 years of age. And the key thing here is, because aging is not inevitable, it is an opportunity. And it's an opportunity that many people don't have. And most importantly, there are many things we can do to enhance this opportunity for aging. We need to fight a uniformly negative view about aging. Perhaps best said, example from William Osler, the great Oxford Hopkins physician, that most effective, moving, vitalizing work of the world is done between the ages of 25 and 40, and after that, it's all downhill. This is not only just an old, archaic view. It's still seen in many places. An example maybe in Japan is the mandatory retirement still around the age of 65. But we know this is not right. Darwin wrote this important book when he was 72. And we had a visit from Eric Kandel a few years ago, who at 91 is still publishing actively, a professor and Nobel laureate in Columbia. So to present the view that aging is not inevitable and it's an opportunity, I would like to propose 3 goals for aging. The first is not dying, which is rather obvious. We'd like to survive. Secondly, we don't want to be sick. We don't want to have disease. But I think it's critical that this is not enough. If our goal is only not being sick and not dying, then we're not prepared for what will happen with aging. Because with aging, as I said, there are declines in function, and the balance, the homeostatic balance of the organism becomes more finely tuned, let's say, more precarious. So we need to be prepared for that. And I think this indicates that we need a third goal, which is being fit. So enhancing and maintaining function and having strong reserves, which I define as cognitive, physical, psychological, and social, are all 4 areas which will determine the quality of our aging. So in preparing for aging, we need not only to think about avoiding disease and surviving, we need to think about preparing for the declines which may occur and being able to survive them. Also being able to survive stresses that can happen, like falls, pneumonia, and so on. So, who says it matters? Certainly, many people, and this includes university professors, many people have the view that it really doesn't matter. They might as well have a good life, eat ice cream and drink too much and eat too much and not exercise because they're getting old, and that's that. And this is the view I want to strongly oppose. And the reasons for that, for this opposition, is evolution is important. We're not prepared by evolution to have a long life because it doesn't help the survival of our children. Because of that, we need to understand that older persons have more delicate balance of processes. They need to pay more attention to their fitness than younger persons. My favorite example of that is, imagine a group of 65-year-old men playing American football. There would be a stretcher on the field after every play, and you'd need a whole train of ambulances ready to take everybody out eventually. Also, genetics is not the only thing. Genetics, of course, is very important, but genetics works through interactions with the environment. And actually, the prevalence and incidence of Alzheimer's disease is declining, even though there are more older people. If you correct for that, the decline in Alzheimer's disease around the world is thought to result from the fact that people are healthier now. They're eating better. There's better control of hypertension. And just a trivial example of this is when I was in college, I had 2 hot dogs every day for lunch. I couldn't imagine ever eating a hot dog again, but that's how I survived in college. But people are eating better diets, so the diet is important. This is evidence for that. There are protective factors for Alzheimer's, but actually for all of these diseases, which can delay onset of stroke, heart disease, Parkinson's perhaps. And there are immune mechanisms which involve the microbiota. The microbiota are the sum of all the organisms, bacteria, fungi, parasites, and viruses which live on our bodies and inside us. And we can change them, and they play an important role in our aging. For most all of human history, we were hunter-gatherers. So the genes we have now were selected by evolution at a different time. They were not selected because they're good for us in regard to our use of cell phones and trains and planes. Our genetic inheritance does not prepare us for this. Because of that, we need to consider the effects of lifestyle choices on these factors and their ability and our ability to age. Moreover, the immune system is involved in all of our aging-related diseases: Alzheimer's, Parkinson's, ALS, heart disease, and cancer, and others and others. And our immune system is influenced, modulated, or it's said educated by the bacteria. And this influences brain function, including brain disease, development of brain diseases, and also normal function of the brain, learning and memory, which is influenced by populations of bacteria in the body. Francis Collins said, genetics loads the gun, environment pulls the trigger. So it's important to understand that it's not only genetics. So for Alzheimer's and Parkinson's, less than 10% of cases are caused by a gene. And even people who have the E44 type of apolipoprotein E, who are at a very high risk of Alzheimer's disease, they don't all get it. So this is a very, I think, a critical concept, that the genes are important, but they're working in interaction with what we do. So it's not that the gene will say, oh, I have a long life. My father lived to be 95 and my mother lived to be 88. I'm okay. That's not right. Or, of course, the opposite is also correct. If your family has a lot of early deaths, you may be able to overcome that by doing the right thing. So this has led me to propose 4 multiple reserves. The cognitive reserve hypothesis is very well established, which means people who are more highly educated are resistant to the development of dementia in late life because they have a more resilient network of neurons, dendrites, and so on, and they're protected from disease. However, I think this is not complete because we need to consider the effect of physical factors, including all of our organs and the microbiota. And undoubtedly, psychological and social issues are also involved here. However, I must say these are not individual or independent. They're all dependent on each other. So social activities improve the health of the heart because they involve physical activity, but they also improve the brain. So all of these reserves are interdependent. And I call it the theory of the multiple reserves because it's not something that will be tested in a big double-blind, placebo-controlled, randomized trial and will be proven to be true. It's just an idea. And I think it's more elegant to call it a theory than just the multiple reserves. This comes from the idea of military forces which are withheld from action to serve as reinforcements. This is what we need with aging. We need to have resilience. So I'm sure most of us know that if their two 80-year-old women fall and break their hip, the risk of dying from pneumonia after they're hospitalized is quite high. But what happens to these two women will depend not only on the nature of their fracture, but on their social support, their heart function, their muscle mass, their immune capacity, and many things. Many, more than 20 different characteristics of these two patients will determine how well they do. So falling and breaking a hip, of course, is a bad thing, but we need to consider how the reserves influence what happens to us. Also, cognitively stimulating activities at work as well as at home are protective. So I have to report, in the 90s, we did this research showing mental activities were important, and other people have also published these findings, as well as physical activity. And I was at a meeting of the Alzheimer's Association, and they had a press conference, and I told about my findings to the press, and I suggested that people should be mentally and physically active throughout life and have a low-fat diet. And the scientific director of the Alzheimer's Association got up and he held his hands up like this and said, wait. Dr. Friedland's recommendations have not been proven by a double-blind placebo-controlled trial. So that's premature, which is just, I think, totally absurd, but it's just an example of how pseudo-intellectual scientists can become sometimes. So here are the four reserves, and they not only influence the development of impairment, they influence the process itself. This is true for Alzheimer's disease, but you could say the same thing for heart disease and also maybe other conditions of other organs. For example, being educated is protective against Alzheimer's disease by having a higher level of resilience to the impairment. However, we believe it also influences the development of the process itself. Same thing for physical factors, social and psychological ones. The physical reserve are basic principles of internal medicine. 9% of patients with renal impairment have cognitive deficits, and on and on. Particularly important, I believe, and maybe novel in regard to the physical reserve, is the influence of the bacteria, particularly bacteria in the mouth, which have been shown to be related to Alzheimer's disease. And with colleagues in Osaka, we've published several papers showing that various oral bacteria can be linked to large and small intracerebral bleeding. And this is often ignored as an important component of what people can do. So I have it on my list, on my checklist to discuss with every patient I see, regardless of the diagnosis. They need to pay attention to their oral health because it's important for the brain. Of course, it's also important for the heart and the teeth, but it's important for the brain. Our largest environmental exposure is to the bacteria in the gut, because we all have 1 to 2 kilograms of living organisms there. On the other hand, a sneeze, and of course I can't get into COVID at this time, so a sneeze nowadays is more frightening than usual, but it's a transient exposure. The gut exposure is continuous, and it's gone on for the past 1 billion years of all of our ancestors. And the gut microbiota influences the brain, and there's a bidirectional axis between the gut and the brain, which involves immune cells. Recently, only in the past year or two, it's been shown that gut bacteria influence the activity of microglia, which are the immune cells in the brain, which are involved in learning and memory. So the microglia are not only involved as detectors, destroying organisms or helping clean up dead cells. They are involved actively in producing synapses, which are critical for learning and memory. And the good part of this is that we can change these things through our diet. We evolved with these organisms, and they evolved with us, and they're under our control. Our actions influence these partner organisms and impact their role in our health. The mechanisms, the pathways by which they can affect us include through the nose, the mouth, and the gut. And this field has seen unfortunately, not enough consideration of nasal or sinus or oral impact. And we'll be learning more about this in the next few years, I'm sure. Psychological reserve considers the ability to maintain mental functions, to avoid agitation, anxiety, and depression. And studies show people who are more stable have more resilience and conscientiousness, and more resistance to impairment. Mark Twain said, "Why are so many of us suffering from tragedies that never occur?" This is very beautifully expressed by Randolph Ness, who founded the field of evolutionary medicine, in a paper called "What Good is Feeling Bad?", where he describes that there is an evolutionarily adaptive capacity, or there's a reason why depression is something which can be a warning that there's something wrong. So the critical point here about psychological reserve perhaps is that depression should not be considered to be a citalopram deficiency disease. Social reserve describes our interpersonal networks, and Alzheimer mice who are isolated have worse disease. And the risk of Alzheimer doubles in people who are lonely. Of course, this is another example of how these reserves are interdependent, since loneliness involves less physical activity, less cognitive activity, more risk of heart disease if there's less physical activity, and so on. Now, what can be done about this? I've listed here a number of avenues. Particularly, physical activity is good for us. Health of all the body systems, mental activity, psychological measures, social factors. These are all things that people can do. And you don't have to, of course, you don't have to wait till you're retired, or you don't have to wait till you're 80 in order to consider these factors. the different applications to these ideas cannot be divided into the multiple reserves because they're all interdependent. So the wonderful thing is we can change our microbiota in a period of as short as 2 weeks. This was shown by a brilliant study comparing bacteria in Africans and African Americans. But just one example is that fiber-containing foods enhance the production of short-chain fatty acids in the gut, which epigenetically modulate the production of regulatory lymphocytes in the blood, which enter the brain. And the regulatory lymphocytes enhance tolerance, which is probably a good thing, which leads to better control of inflammation. Many diseases, including Alzheimer's, Parkinson's, ALS, and others, are involved with too much inflammation. And anything we can do to lower the activity of the immune system may be good. And we can do that, of course, with steroids, which is quite dangerous. But we can also do it by eating less meat and eating more fiber. Fiber is a component of carbohydrates that we can't digest. And meat has no fiber. Particularly high in fiber are nuts and beans and whole grains. So it's my proposal that we don't need white rice and we don't need white bread. So these are some dietary recommendations of what things that are good, that may be good. And chicken is probably better than beef or pork, and fish is probably better than chicken. An important concept that is not widely recognized is diversity of intestinal bacteria is good for our health. But in order to have that, we have to have a diverse diet. So it's not enough just to eat good things. You have to eat different good things. Sugar increases inflammation in the body. Also, salt, aside from its contribution to hypertension, it increases the inflammation. Both of these things are through interactions with the microbiota. So it's advisable to eat a plant-based, low-saturated fat diet with little meat. Yuval Harari, the Israeli historian and author, has said that McDonald's and Coca-Cola pose a far greater threat to your life than Al-Qaeda or the Islamic State, particularly because of the epidemic we are facing of diabetes, which is, of course, related to dietary factors. So if we consider what we eat, a new concept for me is that meat is occupying space on your plate that could be used for something else. Because the meat is not helpful toward the growth of healthful gut bacteria. Because meat has no fiber. So it's not only that meat might not be good, it might be high in saturated fat. But also it would be better to be eating more fiber. So scientists have studied the diet of hunter-gatherers who live in the environment in which our genes were selected. They consume a much higher level of fiber than we do. So it's not only we want to have a dose of fiber when we eat, we want to have more fiber, perhaps more than 1 or 2 doses. Green tea is quite remarkable. It's been shown that the Japanese in Kanazawa in Western Japan who consume more green tea have a lower risk of Alzheimer's disease. And it's possible that this is because green tea has polyphenols that impair the production of amyloid by bacteria. And these amyloid products, according to our research, could influence the misfolding of neuronal proteins, including alpha-synuclein for Parkinson's and amyloid beta for Alzheimer, and also create more inflammation. Green tea has antioxidant, anti-inflammatory effects as well, and I'm not aware of any dangerous side effects with green tea consumption. For physical and mental reserve, we need to have exercise. And a key component there is exercise cannot be dependent upon the weather. And ownership of an exercise bicycle does not count as exercise. It needs to be used. And learning is good for the brain. It changes the structure and complexity of the trees, which are the neuronal component of the forest here in the cortex. So a life filled with learning is desirable. Exercise in nature may be better. Again, because this is where our genes come from. Sedentary activities are bad for the reserves, both the psychological, social, and physical reserves, and cognitive reserve. And evolution has not prepared us for this. So 5,000 years ago, there were no sedentary persons because we needed to get water and food every day. There were no stores. So we're not our genes have not developed to allow us to have a sedentary life. And the health of the body is certainly good for the brain. And the brain is dependent on all the other body parts. And maintaining a socially active lifestyle in later life enhances cognitive reserve. Again, showing the interdependence of these reserve factors. I think I will an interesting concept is that our response to stress is not entirely psychological. So 5,000 years ago, again, if we encountered a stressful event, like let's say we went on a new path and were attacked by a tiger, it is valuable to remember that. So stressful events have a more salient way of being reflected in the brain. So dealing with stress is not only a question of getting over it, but a way to learn to live with it, because there's an evolutionary component in which these memories are more firmly established in the brain, which is why they're so difficult to get over. Again, the perspective of evolution, of human evolution, can help. Meditation can help with all these reserve factors and helping us to understand that we can choose what we want to think about. We can choose what we do. Also, it's not widely recognized in consideration of hazardous behaviors that there are good mechanisms produced by evolution to protect the brain from multiple blows to the head. However, this applies only to woodpeckers. Woodpeckers have membranes to protect the brain from injury, but not humans. And CTE has been found in over 90% of NFL and over 80% of college players. And it is very difficult or impossible to diagnose, and there's no treatment. So head injuries, small head injuries are bad, big head injuries are bad, single head injuries are bad, multiple small head injuries are bad. Francis Collins has come up with the idea of using genetic information to assist in healthcare. and he calls it personalized medicine. I object to that very strenuously. I believe that personalized medicine is exactly what every doctor should have been doing in the last several hundred years. We should all be practicing personalized medicine. We don't need to know anything about their genes, patients' genes, in order to do that. So I'm not opposed to using genetic information. I'm just saying we shouldn't imply that this is what personalization is. So in dealing with these 4 reserves with our patients, we need to personalize it. We can't just ask every patient to do the same thing that every other patient does. So we need to consider what kind of person they are. What are their unique cognitive backgrounds and physical functioning and social environment and psychological makeup. So our recommendations regarding actions concerning the opportunity of aging needs to be personalized. And in conclusion, a key factor is diversity. So I mentioned that we want diversity of diet, but we also should consider diversity of activities. So for more than 30 years, I would go to the gym and only did aerobic exercise for various reasons. And I think now that I am older, I realize that was a mistake. I should also have done strengthening and stretching. Mm-hmm. So diversity of activity is just as valuable as diversity of diet. But we also need diversity of social contacts. It's good to have complex networks of people, especially when we're older, and we will find that many of our friends and family members are dying. In conclusion, I believe aging is not inevitable. But because we appreciate it as being not inevitable, it doesn't happen to everyone. If we have an opportunity to get old, we should consider it an opportunity, a chance. And the quality of our aging will depend on what we do. And we must work to enhance these 4 reserves throughout life, to maintain our resilience with aging and increase the chance to appreciate this opportunity. I looked up the word opportunity in the Oxford English Dictionary or the online etymology dictionary. And an opportunity is a favorable wind coming to port. And that's, I guess, why the word port, P-O-R-T, is there in the word opportunity. And I think this is quite a beautiful concept of a favorable wind coming into port as we get older. We need to take advantage of all the favorable winds we can find, especially those that will help us to age well. And the concept of the multiple reserves help us to manage our sails so we can gather these favorable winds and use them throughout all stages of our lives to achieve and maintain the meaning of our life. Because it makes a difference what we do. Finally, I considered giving the title of this talk, Arguments with Aging. And going back again to the poet Lowell, who said, there's no good in arguing with the inevitable. I believe since aging is not inevitable, we need to argue with it. We need to be actively involved in the process of aging and not think that when you're going to go, you're going to go. We cannot be passive observers. There are many things we can do to improve the quality of our aging. And my book on this matter, which deals with these concepts in a more comprehensive style, will be published by Cambridge University Press in September or October. And I will be certainly grateful for feedback from all of you by email or other ways about what you think about the concepts and perspectives I present here. Thank you very much, and I will be pleased to address your questions.
May I ask you a question, sir?
Yes.
Can you hear me? Can you hear me?
I can barely hear you, but please go ahead.
I enjoyed this talk very well. And what I feel, I'm getting older, what I feel, that regardless what I do, my wife does, there's one issue that's missing, which is encouragement by people around you. I'm not talking about the family, I'm talking about society in general. I'm from a different part of the world. Old people here are encouraged to get old, not stay young. I'm still working, and the people around me are very good, and they're helping me. But the joy that came in associating with other people is lacking because the other people ask me every day, why am I not retiring? They don't pat me on the back saying, good luck to you, you're still working. On the other side, they say, why are you working? I think that part, humans generally are happy if they're amongst the other humans. That part is lacking in the society. Regardless what you do, what you have suggested, I think that psychological support that should come from other people around you is missing to some extent. I'd like to hear what your comments on that.
Yes, well, thank you. You're absolutely right, and that's very important. And our society should be encouraging the active participation of older persons in every aspect of life, like teaching. In Cleveland, there's a concept about intergenerational schools where older persons are participating in elementary schools and other schools, which would be a wonderful thing. And social mechanisms enhancing the active participation of older persons in schools and in other activities. And you're right, this is very important and certainly a key component of psychological and social reserve. And I wish I had a better idea of how this could be accomplished. I have thought that Medicare should provide money to older persons, not only in terms of cash, but money that could be spent in participation in activities, in taking classes, and traveling and learning new things, which would be good for health and actually lower healthcare costs.
Hey, Rob. Rob, can you hear me?
Yes.
Rob, this is Tom Buttinger.
Hi, Tom.
You have been very comprehensive, but there's one thing that occurs to me that we need to emphasize that you haven't mentioned yet. It has to do with the military idea of intelligence. So you use a military analogy having to do with reserves. But without intelligence, having to do with surveillance of where the enemy is coming from, we can be led into dangerous grounds. I'll give you an example. I asked a few months ago a number of cardiologists whether beta blockers had anything to do with brain function. And the answer was uniformly, no, there's no evidence. But in point of fact, beta blockers do cause or are associated with dementia. This is a study just published 2 years ago. It's probably the biggest study of comparing dementia and beta blocker use versus dementia and not beta blocker use. So I just add this as an important aspect. What is the enemy? The enemy is treating atrial fibrillation with a beta blocker and not recognizing that an onset of dementia, which I've noted in a patient, could be associated with the use of beta blockers. There's many other aspects of this importance of having the surveillance of to what extent new things introduced into the environment might have an influence, negative influence, on brain function.
Yes. Thank you very much, Tom. A major component of physical reserve are medications. And it's very common that older persons are taking the wrong medication or the wrong combination or the wrong dose. And we see this at least in 75% of my patients. They're helped just by adjusting medications, removing something, or changing the dose or the dose schedule. And it's an enormous problem. Why this has not been approached through artificial intelligence, and why Epic doesn't have any, why our electronic health record doesn't have a computerized assessment of medications. I saw a patient yesterday who was taking 25 different medications, and it's just impossible that she's taking them properly, and it's not possible that the combination of all these drugs is not having a negative impact on her health.
Thank you.
All right, Dr. Friedland, a couple of things from the chat area. One was from actually a comment from Dr. Ruth Simons, we know very well, and she says that my mother was a poster child for good aging, and my father absolutely the reverse. The difference in their life experiences as they aged was striking. She says, I am taking this to heart and have thought a lot about all the things that you have said. So a nice comment from her. And a couple of questions. The first is from, maybe real quick, from Nicholas Kuipers. He wants to know, could the 4 reserves be applied to refine Stephen Krieger's topographical model of neurological reserve in MS patients?
I'm not familiar with that particular model of reserve, but certainly it could apply to MS patients in some way. And MS has been linked to intestinal bacteria, so that there are people working on remedies that can be directed toward the intestinal bacteria, which would lead to a lower level of immunity, specifically for things which might damage the white matter.
All right. Another question from Neha Neethi wants to know, said, thank you for the insightful talk. Her question is, what are some ways we can stay cognitively sharp outside of medicine, things we can do at home, specifically given the constraints of the pandemic and many of us residents in training during an unprecedented, more stressful time?
I think participation in learning is is important, and so I'm not sure if this person is in training in medicine, but so learning about medicine, which is of course is their job at the moment, is good. Everybody should have some aspect of learning in their activities, and it's probably, I think it's good to avoid complex stimuli which have no educational or learning component, such as a lot of television. For example, daytime television is generally toxic. It has more stimulation than you could possibly follow, and there's nothing that can be learned from it.
All right, one more question. This is from Satya Durugu. Says, I have a question. When we talk about diversity of activities, is it better to have a diverse groups of well-cultivated hobbies from young ages, or more novelty-seeking activities in old age?
Yes, it's good to have novelty-seeking activities throughout your life.
Very succinct. Dr. Kruger, Dr. Rimmel, would you guys have anything? Would you guys have any questions you would like to have for Dr. Friedland? Or
a couple comments I have. Of course, I'm sitting on my hands here because he's been talking about microbiota and also about attitude. And Rob always gives these balanced talks that bring together the science, because he's a scientist, so he can speak truth to what he's done. And he also brings together everything else in the environment. Because he mentioned pseudo intellectuals, that was a nice, eloquent way of saying stubborn scientists that demand randomized controlled trial for everything. I can't get people to take magnesium to stop atrial fibrillation or vitamin D to reduce the chance of respiratory viral infections. And you're right, we can't talk about it in COVID because we're told that we have to listen to only the experts. And so how do you avoid the bias? My big question is translating all of those good things that you talk about that ring true to our ears. How do you translate it into our patient population when you'll have an overweight person telling you they can't get up and exercise because their knees hurt, and they can't change their diet because they don't have a way to get to the grocery store, and the frustration that comes with not being able to deliver those good messages you're giving, Rob? Do you have ideas of how we can translate those good messages? I know you wrote a book, but how can the doctors listening in start to change the biases and attitudes of people around us about healthy living, healthy lifestyle?
Yes, thank you for that wonderful question. That's exactly what I try to do, and it's difficult. On the one hand, I point out what's possible. I tell them, okay, Mr. Jones, you're 70 years old, and your chance of living to 80 is not very high because of this, and this. But if you do these things, you'll have a better chance. That might not work. That actually often doesn't work. So if I learn about them, I may find out, like, oh, I understand your granddaughter is now 12, and he'll say yes. I'll say, would you like to be there when she graduates high school? And he'll say yes. I'll say, well, if you don't do this and this and this, the chances that you'll be there in 8 years is not very good. Do you want her to graduate high school thinking, I wish my grandfather was here? And maybe, assuming he loves his grandchildren, and maybe that can put it in perspective, rather than just, you won't live long, or you have a higher risk of being infirm at that age, but you won't be there for your grandchild. And at least it's something to try, or just to show them that almost everyone is capable of some exercise. So if their knees hurt, maybe they can go to the gym and use a machine that goes around like that. Or they can lift weights at home, or they can use a stretch band at home. Or I've had knee pain where I couldn't walk fast, but I could ride a bicycle, a stationary bicycle. So whatever they can do, if you go over their opportunities for activity. And the problem here is we're not paid to counsel people in this way. It takes more time, and we have more stress for seeing patients quickly, but there's no way that this can be done, without getting to know people and making it personalized for each person, each patient.
Outstanding. I have a feeling, Dr. Furman, do you have anything? You look like you have some. You look like you're ready to talk.
I was just going to say, I just put in the text, in the chat, because I know there's not a lot of time. But I really take an interdisciplinary team approach. I don't think the doctor's going to be able to do all this. I think we need the social worker, the physical therapist, the occupational therapist, the speech therapist. Dr. Rimmel, I know you love speech therapy. The whole interdisciplinary team. And sometimes it's non-medical professionals, like we have at the Flourish here at our Traeger Institute Optimal Aging Clinic. We're doing these Flourishing Together classes, and they're run by non-medical people, but have been trained to, how to. It's all about inspiring people and definitely working in teams and holding each other accountable and making it fun. It can happen, but it takes a team approach.
Certainly. Very good. I wish that we had that more widely available.
Right. And you wish our healthcare system paid for it, because it's all based on grants right now.
Exactly. Right. That's right.
Well, all right, Dr.
Friedland.
Oh, go ahead. Dr. Rimmel, was that Dr. Kruger, Dr.
I just wanted
Rimmel,
to thank Dr. Friedland. Yeah.
Outstanding, and at the great talk as always. And we always love our visit each year from Neurology. And Dr. Kruger, did you have anything you would like to conclude with, or?
Just no, I like the positive personal accomplishment and attributes so that we treat our patients as humans and, as Rob says, not as humans with disease. So that was just fantastic. Lots to think about. Thank you very, very much.
Thank you very much, everyone.
Thank you, Dr.
Thank you.
Friedland, and thank you, Dr. Remmel. Again, like I said, we always look forward to our visit from Neurology every year, and this is outstanding as always. So thank you so much again. So
Thank you,
it's
everyone.
a great collaborative effort. I want to thank Lilia as well. She really helped get everything pulled together, and I really appreciated her help as well. So thank you, everybody, and we will be back next week, 8 o'clock. And actually, GI will be our topic, and it'll be Dr. Uni Wong from the University of Maryland. I have a feeling we'll be speaking about IBD, but we'll see. So thank you again, everybody, and a great crowd today, and really appreciate all the folks from Neurology joining us today. And again, the collaborative effort between the two departments went really well. So thank you so much, everybody.
Thank you, Jason.
Thank you.
Thank you.
Thanks, Dr. Kruger.
Bye, Rob. Thanks. I'm looking forward to reading your book.
Thank you very much. Thank you. Hello, Alice. Oh, Richie? I can't hear you. Hello, Dr. Sanwar.
Yeah, I think they have their mics muted. That might be that
Yes.
for they need. Yeah,
Okay.
so, but,
Okay, thank you. I'll hang up now.
all right, we'll see everybody. Thank you again, Dr. Friedland. It was great working with you again.